Did you know that the elbow is called the unforgiving joint? Even a small injury can lock up your movement for weeks, sometimes months. In this video, we'll break down why the elbow joint is so tricky, and more importantly, how you can keep it strong and pain-free. Let's physiofy this together. Hey everyone, and welcome to another episode of Physio Talks with Dom. I hope you're having a great day, staying healthy, and more importantly, being active. If you're here for the pain or just for information, you're in the right place. Before we jump into the topic, I want to clarify some myths people believe about the elbow joint. Myth number one, the elbow is just a simple hinge. Actually, it's a 3 joints in one. The humeroradial, the humeroulnar, and the radioulnar. I'm going to explain this later, don't worry. And these 3 joints are responsible for bending, extending, and rotation of the elbow. Myth number 2, only athletes get tennis elbow. Actually, it's not true. Most of people who get tennis elbow never touch a racket in their life. It comes from repetitive gripping, lifting, and twisting with the elbow. And of course, from using a lot the mouse or a computer. Myth number 3, if you rest an injured elbow, it will heal better. Actually, as we said before, the elbow joint is the unforgiving joint, so it's important to move it. If you rest it completely and immobilize it, it will lead to stiffness. So, gentle movement is the key. Myth number 4, elbow pain comes from always the elbow itself. Not quite. Sometimes pain is referred from the neck or shoulder, not only local injury. Myth number 5, a swollen elbow, student's elbow, always means infection. Not quite. This kind of injury can be caused from constant pressure, not infection, but some need medical attention. That's why in today's episode we're going to cover firstly the anatomy of the elbow joint, secondly the movements of the elbow joint, common problems and injuries, and lastly physiotherapy techniques and mobility. Alright, let's get straight into it. The anatomy of the elbow joint. The elbow joint is a hinge type synovial joint which is formed by the ulna, the radius, and the humerus. It's responsible for bending and straightening the arm, as long as the radius is responsible for bringing your palm up and bringing your palm down, the supination and pronation. Stability is provided by the ulnar and the radial collateral ligaments and the annular ligament around the radius. The muscles which are responsible for the flexion or bending the elbow is the brachialis, the brachioradialis, the biceps brachii, and the pronator teres. The main muscles which are responsible for the extension or straightening the elbow are the triceps brachii and the anconeus. The pronation and supination is also a movement of the elbow, which is the pronation is the palming down movement and the supination is the palming up movement. Now let's move on to the most common conditions for the elbow joint. And the most frequent condition of the elbow joint is the tennis elbow or the lateral epicondylitis, which is an inflammation of the lateral epicondyle of the humerus. This problem comes from overuse of the forearm grips. This movement, specifically the extension of the wrist, common in repetitive gripping and lifting. Let's now move to the second most frequent problem of the elbow joint, the golfer's elbow, which is exactly the opposite of the tennis elbow. Instead of going to the outer, it's on the medial part of the elbow joint, specifically the medial condyle of the humerus, which is derived as well the same way of the lateral one, but in the opposite movements. Instead of going to the extending of the wrist, on the extension of the forearms are due to the repetitive flexion of the wrist, of the forearm specifically, repetitive movement of the forearm muscles. So in this case, when you overuse this movement, specifically gripping something a lot, very heavy, something you cannot handle, can cause the golfer elbow. Now let's move to another category which are very frequent and more severe. So the most common fractures and dislocations of the elbow joint are the following. Radial head fracture. The most common one, the cause of the fracture is falling on the outstretched hand. The problem can rotate the forearm because the head of the radius is broken and can't rotate. Second fracture, olecranon fracture. Cause of the fracture, direct fall with bended elbow. Of course, the problem is you cannot extend your elbow. Distal humerus fracture, one of the most severe ones. And to explain briefly why is the most severe fracture of the elbow joint is because there is a complex with arteries and it's very dangerous. Whenever this part of the humerus breaks, can cut and cause very severe bleeding. But for now, it's enough to know in this type of information. Let's go to the fourth fracture, the coronoid process fracture. This is a rare one, but mainly it's the process of the ulna which is broken. This one often leads to dislocation of the ulna, and the problem is instability. And lastly, a classic combo of fracture and dislocation is the Monteggia fracture dislocation, which is the ulnar fracture and dislocation of the radius. This information about the fractures are enough for you for right now to learn. Let's move on now to the next common condition of the elbow joint, the cubital tunnel syndrome. The cubital tunnel syndrome is the second most important nerve entrapment syndrome after the carpal tunnel syndrome. The carpal tunnel syndrome we're going to mention to later videos. So what is the cubital tunnel syndrome? The cubital tunnel syndrome mainly is the entrapment of the ulnar nerve in the inner elbow, causing tingling, numbness, and weakness of the hand, especially on the ring and little fingers. Let's move now to the olecranon bursitis. As I mentioned before, the olecranon is the tip of the elbow, and there is a bursa. The bursas are cushioning sacs, which are cushioning sacs to protect the joint. So the olecranon bursitis, if you want to give you an example, when students sit all the time like this in the class, they press specific part of the elbow. So this one, after a long time of pressure, can cause the student's elbow, the olecranon bursitis. And as we mentioned before, this is not an infection, it's an inflammation, because there is a repetitive pressure on that point, which can cause inflammation of the bursa, leading to visible swelling of the elbow. And lastly, there is another condition which hit not only the elbow joint, but all joints of the human body, is the rheumatoid arthritis. Including the elbow, the rheumatoid arthritis is an autoimmune condition which causes inflammation to all joints, causing also pain, stiffness, and over time, joint deformity. And of course, usually it affects both sides of the body. And a fact worth mentioning, the rheumatoid arthritis hit symmetrically both elbows at the same time. So in this section, the physiotherapy and mobility is just for some self-treatment or self-improve/maintenance of the elbow joint health. It is not said to replace the actual physiotherapy by yourself. If you have one of the previous conditions, please take a medical evaluation. Now let's move to the actual self-treatment I recommend to you as the first thing you can do at home. The gentle range of motion regaining. So gently try to flex, extend the elbow joint, supinate and pronate the forearm. This one, after repetitive movement, if you have an block and ankylosis in a medical term, helps to regain the range of motion. And the goal for all this is to restore the range of motion and being pain-free. Let's move now to the next chapter of this section, the stretching. Forearm flexor and forearm extensor stretch. The forearm extensor and flexor are very important to stretch because you are going to keep a sane status of the elbow joint. So the forearm flexor stretch, you keep your arm straight, palm up, gently pull fingers back. The forearm extensor, the forearm extensor stretch. The forearm extensor stretch, you keep your arm straight, palm down, gently pull your fingers towards you. And of course, the goal for this is to reduce the stiffness and prevent overload. Step number 3 for the physiotherapy and mobility is, of course, the strengthening. Strength in the forearm and generally the elbow joint is very important to keep the inflammation away from you, because usually weakness and overuse of the elbow joint, which is very common because you want to grab something and you cannot, or you insist on pulling something very heavy and you are unable to do it. So repetitive movement of failing that movement can lead, of course, to an inflammation, because if you are weak and you continue to do this exercise or movement, you can lead to an injury. So for the strengthening, you can start exercising with resistance bands. Besides the resistance band, you can use also some small weights. You can focus on wrist curls, reversed wrist curls, and grip squeezes. The goal is to build muscle and tendon endurance around the joint. Lastly, for this section, the functional mobility. In this section, you combine some movements of the elbow. You combine like bending and rotating at the same time, and do the opposite while extending and rotating to the other side. Progress slowly and avoid pain. And the goal is to make the elbow stable and resilient for daily use. And that's the elbow joint, how it's built, how it moves, which are the common conditions, and which exercises help to keep it healthy. Now let's wrap things up with the key points you should remember. The elbow joint isn't just a hinge joint, it's 3 joints working together. Stability comes from strong ligaments, while movement depends from balancing the flexors, extensors, pronators, and supinators. Most common problems like the tennis elbow, the golfer's elbow, and bursitis are derived from overuse and poor mechanics. The good news is that stretching, strengthening, and simple mobility can prevent all of them. Keep your elbow moving, keep it strong, and it will take care of you. If you find this video helpful and you want to share with someone, feel free to share it. Maybe you can hit like or subscribe to the channel, which helps me a lot. Thank you very much, and I see you in the next one. And always remember, keep moving so you can keep living.